All right, please confirm that you can see my screen. I'm looking at the in-text messages, the chats. I can't see emojis at this point, but please, somebody should just confirm that you can see my screen. Okay, 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 perfect. All right. So, this evening we're going to study together. The reason that I muted us was because usually it's like a challenge having everyone control their microphones. But I'm going to unmute us at some point because we're going to make it a little bit interactive. But I would also try to see how we can, compress, make it quick, make it fast so that we can cover maybe two study sessions today, or we cover one study session, and then if you remember the revision questions that I put up for study session two, we can use that revision document to simulate how to answer applied questions. Okay, so today we're going to be looking at, I'm starting from chapter 6. I know that we haven't done chapter 4, chapter 5. I'm not certain that we have done chapter 3, but I'm starting from chapter 6. Then we can do the other chapters as we go on. So chapter 6, the focus is on interdisciplinary collaboration in public health. That's the part A of it. Okay. That's the study session 6, part A. It begins with interdisciplinary collaboration in public health. So the first thing I want to ask us, just a quick yes or no. Do we think that the problems in public health, the kind of problems we encounter in public health, do we think that there are problems that only health professionals are necessary for solving those problems? Do we think yes or no? What do we think? Do you think that only health professionals are required to solve those problems? Okay, so I've gotten a couple of no's. Okay, so that brings us to the discussion for today. The thing we're going to be talking about is collaboration. Like we have just implied by our responses, the kind of problems that we have in public health, they are not problems that strictly public health professionals, they are the only ones that can solve the problem. In fact, if we've been studying, all other courses, not just this one, you would see how they keep talking about, that all the sectors need to be involved. Everybody needs to be involved. In fact, there's a thing called HIAP, Health in All Policies, where it's even saying that regardless of any sector you are in, any policy you want to make in that sector, you have to consider the health implications. Because you cannot say my own is just transportation. That's we're in the transportation sector. Okay. But transportation sector, you can see that if the vehicles we have on the road, if they are not checked for roadworthiness, you can see all these vehicles that will be emitting fumes, carbon monoxide, that are deadly, that are not good for human health. If we have those kind of vehicles and they are all over the place, it's problematic for our health, right? You can't say my own sector is education, or I mean the agricultural sector. You will see that when we think of it deeply, every sector, there's always like the health implication of every sector. In fact, this last week or last 2 weeks, one of the thing, I'm in Kwara State, and there was this community where bandits attacked them. And we had like a session with that community. It was organized by UNICEF, and there was one NGO that's and then they brought in other ministries in the state: Ministry of Health, Social Development, Ministry of Education. So what we're doing there was, trying to train the community volunteers on how to handle the psychosocial, the psychological effect of this bandit attack on children. So when we were conversing with them, one of the things that they noted was the fact that they don't have healthcare services because three health officers in their in the clinic they have there were shot dead. So they don't have healthcare services. It was disrupted. Also, the people who died in this community, they had over 200 people that died in the community. These people were buried in shallow graves. Now, the implication of that, especially with the rainy season that is setting in, you can imagine what the implications of burying people in shallow graves would be. So we can say, is security sector, what is the health in it? But when we look deeply, we would see that there's health in almost all the sectors. And, I'm just using it to make the point that we can't rule out collaboration. The problems we have, the healthcare problems we have, we can't say it is strictly public health that, that would, professionals that are necessary for it. We need everybody, all hands on deck. So that's why collaboration, that's why we need to study it. That's why it is important. It's an important concept for us. Okay. So we're going to look at the key terminologies because it has all of these terminologies that may be a little bit confusing. So we're going to look at these terminologies and see how we can make it we can understand them. And then we look at a little bit about the historical evolution, and then look at team science approaches and benefits and barriers or challenges to collaboration. Okay, so I'm going to begin with the history. Then after the history, we'll now go to look at those definitions, how to distinguish between the different types of collaboration. So we'll just run through the history, okay? So first of all, when we started talking about when public health even started to become a thing, when it started to, emerge, was with all of the infectious diseases that ravaged humanity during the 1800s. So 1800 to 1870, we had the rise of, the sanitary reforms. And what was happening then, it was like the realization that, we can draw a link between unsanitary environment and illness and disease. So then, like in the UK, there were all of these incidents where, you'd have different outbreaks, not just in the UK, all over the world, actually, you get. So that was when we started having people like Chadwick, when they came up and they started making links between dirty environment and disease. So that was how public health started even coming up. That was where it started becoming a thing. And in those times, there was nothing like collaboration. People were just working. So then when they found out that, okay, unsanitary environment was what was resulting in disease, that was where what was invoked then was mostly engineering. That was where people were building all of those, the Romans were making buildings, trying to build public toilets, public baths, and all of that. So that was what was happening then. But there was really nothing like collaboration then. Okay. So after that time, we now come to the next era, which was from 1880 to 1920. So there's no need to cram, actually. There's no need to cram. We just know that, first of all, there was a link between dirtiness and ill health. And that was that time where we were having, they now started to make links between those two things. And it was during industrialization era where, more people were going to the cities. And with the overcrowding in the cities, dirtiness was becoming a thing. And then it was resulting in more illness. Okay, so there's no need to cram. Now, after that time, the next phase now became the phase where we now started, the scientists, the people then now started to become more particular to say, it's not just dirtiness that is even the problem. That for somebody to actually become sick, that there are actually microorganisms, that this dirty environment, they are actually like breeding ground for different microorganisms, and it is those microorganisms that are now causing diseases. So that was the time when the germ theory was, in vogue. People that were at the center of it this time were like the laboratory scientists. They were always using microscope to view what is the germ, what is the organism that is in charge of this. Okay, it is Vibrio cholerae that is causing this cholera. It is tuberculosis that is causing this one. You get. So from sanitary reforms, where it was just people just felt okay, it was dirtiness. Now we became more particular to say it's not just the dirtiness. That dirtiness is a breeding ground for microorganisms. So they started, identifying the microorganisms that were in charge of these diseases. Now, at this point, what we're studying is the history, the evolution of collaboration, of interdisciplinary approach. So at this time, it was now mostly laboratory scientists and, like the doctors. They were the ones that were more in charge of this in this era. Okay. Now, we now leave this era. We now come to the point where, because after this germ theory came up, there was a lot of progress with infectious diseases. We made a lot of progress with curtailing infectious diseases. When they found out those the causative organisms, they would develop antibiotics, antiviral agents, and all of that. So they had made a lot of progress curbing these infectious diseases. And then we now realize that it's not only infectious diseases that we have. There are some diseases that is not any microorganism, anything that is causing it. There are diseases where, is this thing recording? Okay. There are diseases where it is, like, when we talk about the web of causation, there are so many things causing it. For instance, diabetes. For instance, all of the cardiac diseases that we have, that you cannot say it is a microorganism that is causing it. No, it is a mixture of genetics, what's happening in the person's genes. It's a mixture of the kind of lifestyle the person is living. Is the person working out? Is the person having a sedentary lifestyle? Is a mixture of the kind of food the person is eating. What kind of foods are they eating, healthy or not? So you see that this period, it was not like that it's not just microorganisms we should be pursuing. So we've left that germ, this thing. Now it's not like we left it, but we've moved to a more complex knowledge base. That it's not just microorganisms that we should be looking at. We're looking at multiple causal factors. Okay. And at this point, we're now seeing that no, we cannot just be doing lab people and doctors and people we cannot just be the focus it cannot be on them. They are not the only ones that can bear this thing. And so we now started to talk about, there's epidemiologists, there are people who talk to us about lifestyle, health educators, nutritionists, the doctors are there, the laboratory people are there. Everybody come in. Let's see how we can improve health. So this was also the time where WHO came up with that holistic definition. You remember that definition, that where we are saying that when we're talking about health, it's not just, is your physical body okay? Okay, you don't have any disease. You're fine. No, that we're even looking at mental health. We're looking at environmental health. Are you living in good environment? We're looking at social health. Do you have support systems? You get financial health. So you can see that at this point in time, we're no longer having a myopic view. It's no longer just the biomedical view of health. So this was where, collaboration started to actually become a thing. Okay? So that was where we're saying we need multiple approaches. Everybody in your own area, we need multiple approaches towards healthcare, towards improving health. Okay? And then after this time, we now move on to the part where it now even dawned on us that It's not just even health, and talking about people that are in the health field, though. That was where they brought about the Ottawa Charter for Health Promotion in 1986. You get where it had that 5 priority area, and one of the things that it was talking about was how that was where that policy aspect came into play. That is not just health workers that we're even going to be looking at. Everybody needs to be on board. We need policy makers to come on board when we're talking about health care. Okay? So we now leave this aspect, we now move on to where we now start talking about the Millennial Development Goals. That was the MDGs, which now morphed into the Sustainable Development Goals, which are goals that we are looking at achieving by the year 2030. And here, it now had a broader view of health. It was broader and more interdisciplinary. So we're not just working in parallel. We're going to see the definitions of all of these things later on. You get, so now we're talking about interdisciplinary. I know that you're working in health, but you're not going to be working on your own road and me, I'm working on my own road. We're going to be having meetings together. We're going to put our heads together. Okay? Then after this era, we are now talking about what's happening now. We are looking at what the SDGs are still ongoing. But now we're now even having more a broader view of health. We're not talking about One Health. We're not just even talking about in One Health. It's no longer just human beings that we're even looking at now. We are saying even animals, they need to be healthy. Because if you remember 2019, 2020, during the lockdown period, you know how the disease started. It was where? Bats in China. So now we even say, we are going beyond human health. We need to bring veterinarians on board. Animal health. Animals have to be healthy. How can we vaccinate animals? How can we even be doing our surveillance on animals so that we can pick up the signs and symptoms in animals before these things even start to move on to human beings? Because we're seeing now that it's not just human beings that are on this planet. If the animals are sick, we too, we are sick. Apart from the fact that we even eat the animals, if they are sick, they can transmit the diseases to us through different methods, apart from even that we feed on them. And we're also now looking at our environment, because now we're talking about climate change. You can see there was a period, like I know a few weeks ago, where it was like, I had to even be going to eateries because that period too, our lights went bad. So I go just go eatery like this, go sit down for where they get ACRE, order ice cream, and they will think it's the ice cream that I came for. It's not ice cream I came for. I want to collect AC before we buy in my house. So now we are now having a broader view of it. Okay, so that's the evolution. You can see that it kept the way our knowledge kept becoming complex. That was the more we kept requiring more persons to come on board, more disciplines to come on board, more sectors to come on board. So that's the quick history. All right. Okay, so now that we talked about the quick history, I will now go back to let's explain the terminologies. And after explaining the terminologies, we're going to do like a quick coursework. Is there anything in the chat? Yes, aqueducts and sewages. During that period, that was the initial time they started the engineering work that they were doing then. Yes, yes. Okay, so let's now look at the definition of these terminologies. And after looking at them, I will now give us scenarios and ask us to tell us what kind of collaboration we are looking at in those scenarios, okay? So let's look at multidisciplinary method of collaboration. What is happening in multidisciplinary collaboration? First of all, when we talk about discipline is like a field of knowledge. A field of knowledge, a way of understanding. That's discipline. So if they ask your discipline, for instance, my discipline is medicine. That's the discipline I'm in. Your own discipline can be, okay, we've seen something like engineering, that's a discipline. Okay. Nursing is a discipline. Okay. We can list other ones in the chat if they come to us. So that's discipline. Is a way of understanding, is a body of knowledge, a field of knowledge. That's discipline. While profession is a job role. So my own discipline is medicine, but my profession is what? I'm a doctor. That's my profession. So that's the difference between discipline and profession. So discipline is more looking, is more like the let's say academic aspect of it. More like the academic aspect of it, the theoretical aspect of it. While when you're not talking about profession, you're talking about like the actual job, like hands-on aspect of it. So my profession is a doctor, my discipline is medicine. So medicine is a body of knowledge. Well, the job I do, the work I do, my job role is, or my profession is what? I am a doctor. Okay? So that's the difference between discipline and profession. So now when we talk about that something is multidisciplinary, that something is multidisciplinary, what is simply saying is that what? We have different body of knowledge. In multidisciplinary, there are different body of knowledge. And the characteristics of multidisciplinary collaboration is that what? Everybody is working independently. So I may not be aware of what I may not be aware of what the example here is, like planning an obesity program, a program to curb obesity. I may not be aware of what the nutritionist is doing, but me as a doctor, I will be doing my own work to curb that to curb obesity. But I'm not aware of what the nutrition people are doing at their own end. And the nutritionists, they may not be aware of what me I'm doing. So everybody is working in parallel. Everybody's following their own lines. Everybody's on their lane. You dey your lane, I dey your lane. Well, it's the same place we are going to. We are working towards the same thing, but you dey your lane, me, I dey my lane. Everybody is working in parallel. That's multidisciplinary. Okay? Then interdisciplinary is a more, will I say, a more advanced form. In interdisciplinary, what is happening? We are now coming together. So instead of you're on your lane, me, I'm on my lane, the educator is on their own lane, everybody is doing their own work, having separate reporting lines and we're moving towards the same goal, but everybody is just doing their own work. They are not aware of what is happening in the other discipline. The interdisciplinary one, once you hear inter, just think of there's integration. Interdisciplinary, there's integration. There's proper collaboration in interdisciplinary now. So if it is that obesity program that we used initially, it means that this time we're not just working in parallel. Imagine it like friends, they are now together, they are gisting, they are talking, they are going to the same place, they are gisting and talking. Unlike one person is just going on their own, the other person is going on their own. This time now they are together, the five of them, they are gisting. Hey, how fun now? So this problem we have, like, how are we going to solve it? Okay, you're a nutritionist. What do you think? How can this work? How can we curb obesity in our community? Or maybe it's cholera. How can we? You are in environmental. What do you think we can even do? How can we do it? The environmental will say their own. They say, okay, so me and this person that is is an epidemiologist. How can you help? You understand? So there's now is shared. We're looking at it as is the problem is for all of us. We're no longer just everybody working on their own. No, we're not looking at it as together. We are together we're working together to solve this problem. So in this interdisciplinary, decision making is shared. It's not you do your work, me, I do my work. No, we'll not say, okay, you bring your own idea. What do you think? Okay, this your idea is good. How about we modify it like this? Because based on my knowledge, from my own specialty, this is how things go. So how can we, you get? So there's joint responsibility. And in this case, if it doesn't go well, everybody is what? Yes, there's synergy, there's collaboration. If it doesn't go well, everybody is responsible for the outcome. If it goes well, everybody is responsible for it. Everybody is happy. So there's joint responsibilities. And here, the boundary lines between this is your discipline, this is my, is blurred. Here you see they'll be having team meetings. There'll be team meetings. Like in the office last week, one of the things that we were doing was how to set up at the State Ministry of Health. We're working on how to set up what's it called now? Rapid response team, such that at the local government levels, whenever there's an outbreak or an epidemic, that we are not going to be running around to say, okay, oh, so how are we going to do it now? You get, so we're talking about how to set up the team and how to set up our workflow so that once anything strikes, bam, we know that, okay, we already have an SOP. SOP is I've forgotten what SOP is. We already have an SOP where we can say, okay, this is how we work. We have an algorithm to say, okay, this is the first thing we are doing. From there, this is the next thing, this is the next thing. These are the people that are involved in this issue. So that was what we're doing at the office. And in that meeting, we had what? We had people from standard operating procedure. Thank you. So we had people from different disciplines. The environmental health officers for the local government, they were there. The WASH is people who are in charge of water, sanitation, and hygiene. They were there. Which other people? The surveillance officers, they were there. Which other people? Logistics, people who are in charge of logistics and procurement, because you need people to buy things that we need to work. They were there. So you see that even people who are in charge of vaccines, they were there. So you now see we're there making the meeting, trying to come up with plans. So that's interdisciplinary. So there's a particular problem, and we are now coming together, all our different disciplines, to team up to face this problem. If it goes well, it's on us. If it doesn't go well, it's on us. But nobody will say, me, I've done my own. No. No, this time, if it fails, it is on us. If it goes well, the glory comes to us. So that's interdisciplinary. Okay? Now, the other thing we have is what? Transdisciplinary. Transdisciplinary. Now, transdisciplinary is almost like interdisciplinary, but this time we come up with new knowledge. There's something called co-creation. There's something called co-creation. We're coming up with new kind of concepts, new knowledge, new body of, like all of us, we team up together to now create something new that probably wasn't in existence before. We come up with new frameworks that wasn't in existence before. So apart from teaming up to work, there's that transdisciplinary. It comprises of both integration, the type of integration we see in interdisciplinary, but the thing now is that there's going to be what? Co-creation. So it's like interdisciplinary or integrated ways of collaboration plus co-creation. So we have to now come up with a new concept. An example is what is happening in One Health. That's an example, the thing happening in One Health. So we're now coming up with, because we didn't have One Health before. So if you say, okay, those of us that are in charge of human health, those in charge of animal health, those in charge of planet health, if you are bringing us together, we have to come up with new frameworks of understanding, new ways of understanding that is beyond what we used to have, beyond what is obtainable in any of our disciplines. So One Health is an example of it. 3 different bodies coming together to now come up with new concepts. Okay, so that's the difference between multidisciplinary, interdisciplinary, and transdisciplinary. Now, the next thing is what? Interprofessional. Interprofessional, remember that we had already made a distinction between disciplines and profession. And I told us that profession is more like I don't know how to put it now, like actual, like direct service. So in the hospital, for instance, when we are providing care to a patient, you'd see that there are multiple people involved in that care. It's not just the doctor. No, as a doctor, I need to work with a nurse. There needs to be a nurse with us. After I finish prescribing, the prescription has to be taken to the pharmacist. Sometimes we even write consult. We call the social workers to say, okay, this person also needs some form of social aid. So we call social workers to come in. So you see that it's different professionals that we are now bringing in to provide service. So interprofessional is more about direct service provision, like this example I just gave in healthcare, where we are seeing a patient. That's direct service. We are providing service directly to the person. That's where interprofessional comes into play. So you have different professionals playing their own role to provide care to that person. And then we have the cross-sectoral method of collaboration. Now, when we talk about sectors, we already have an idea of what we're talking about. It's like a broad area in society that economy is organized around that area. Like I was mentioning earlier, that transportation is one sector. The environmental is a sector. Education is a sector. Healthcare is a sector. And there are many other examples. So when we are bringing different sectors to come together, we are now talking about cross-sectoral. So for instance, I gave the story of how we were last 2 weeks, how we were working together to teach the volunteers of the community how to care for children who were like all the children in that community, because it's a psychological assault for them to witness banditry. Okay. And I told us that the Ministry of Health were there, the Ministry of Social Development was there, Ministry of Education was there. You see it now. So different sectors. And I also told us that even it was an NGO that was facilitating. So that's non-profit sector. They were there as well. Okay? So you now see that there's collaboration between different sectors. All right. So I hope this made it a bit clear to us. Yes, I'm seeing the wonderful things we are putting up on the chat. It brings health, transportation, social welfare, and all of that. Okay. All right. So yes, combined novelty. Yes. Okay. So let me share my I want to ask a few questions and just to see that we understood what I was talking about. So I'm going to just give us a few scenarios, and we'll read through those scenarios and then answer whether it's what kind of collaboration is happening in those settings. Okay, I'm coming, just give me a minute. Let me be, let me be. When you let me be, let me be. Okay, so I will go back to share my screen. Let me be, let me be. All right, please let me know in the chat box if we can see my screen. Let me be. All right. So let's do this. Let's do this. I would have loved to unmute us, but I don't know. Somebody is going to leave their mic on, and I don't have energy to shout today. Okay, so we'll just be responding in the chat box. So this is the first scenario. I hope it is clear enough for us to see. But this is the first scenario. There's cholera outbreak in a community. A doctor is treating patients at the clinic. Epidemiologist is tracking cases and, creating a line list. Environmental health officer is testing water sources. Health educator is conducting hygiene awareness session. And each of these people I've mentioned, they submit their reports separately to the Ministry of Health. What kind of collaboration model is this? What kind of collaboration model is happening here? Okay, I'm looking at the chat box. Multidisciplinary, cross-sectional, multidisciplinary. Okay, so I need to actually unmute us at this point because I need us to be able to defend our responses. Somebody is going to defend the response for multidisciplinary. Another person will defend the response for what is it called? Uh, can I for cross sectional. So I'm trying to see how uh, all right, so I've asked us to unmute. So please, I've asked us to unmute, okay? So the person who said, I need one person to come up for multidisciplinary and then one person for cross sectional. So or cross sectoral. I think that was what the person wanted to say because there's no sectional. So please explain the rationale behind your choice. We just need like one person, okay? So feel free to unmute your mic when you want to talk, unmute your mic and address the class. All right, let's go. Let's have it.
Hello, good afternoon. Sorry, good evening.
Good evening.
So the reason why I chose the multidisciplinary approach is that the doctors are treating patients, the epidemiologists on their own part are tracking the cases, and then the environmental officers are doing their own testing, while all those health educators are like raising awareness. They are working separately because if it were to be maybe interdisciplinary, they will be working together on the same thing to deliver the same results. But why it is multidisciplinary, but they are all working on their own different places and on different things individually, and they are going to submit their reports individually too. So if it were to be, I would have chosen interdisciplinary, but then the results or more their reports are not combined; they are not one. So each person has to work independently to submit their own results on their own.
Thank you very, very much. Thank you so much. Yes, so someone else said cross-sectoral. Please, Juwaria, you said cross-sectoral, okay? So can we have it? He said he can't unmute. Okay, so let me see. I've asked everyone to unmute again, so try unmuting.
Yeah, hi. Good
Hello.
evening.
Good evening.
Yeah, so why I chose
Maury.
the cross-sectoral it was you said for cross-sectoral, it's a collaboration from different sectors, right? They are all working, and then I didn't choose multidisciplinary because you
Blessing,
said
come
they
and
are
close this door.
Oh
hey.
God, please, Mama Blessing, please mute your
Why I didn't
microphone, oh. Yes, please go ahead.
Yeah, why I didn't choose the multidisciplinary was you said they're professionals from different fields, they're working separately on
Mm-hmm.
an aspect, but cross-sectoral, they are collaborating. So you said a cholera outbreak, all of them are working on the cholera outbreak, but they are working differently. Do you get what I mean?
Okay, so do you do you remember what I explained about sectors or the examples of sectors?
Yeah, private,
Mm-hmm.
yeah, government, non-profit, stuff like that.
Yeah, we also had some other examples of different sector. You've heard like educational sector, Abi.
Yes, health sector,
Uh-huh.
yeah.
Okay, okay. So all of these people here now, which sectors are they under?
They're all under the health sector.
Okay, so it's just one sector we are looking at, Abi.
Yeah, 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 yeah,
Okay,
yeah.
so is there
Okay.
cross-sectoral now?
No, multidisciplinary.
Okay, okay, perfect. And another thing, is there collaboration here? Do you think they are actually collaborating?
Why I chose the color thought it was collaborative was because they are all working on the cholera outbreak. Even if they are working separately, it's all on the cholera outbreak. They are just giving their own.
Okay, okay, I get it. I get it. I get what you're saying. I know they are working on the same thing, but if they are working in parallel, like if everybody is facing their own work, you see how
Okay.
the doctor is treating patients, is facing his
Yeah.
aspect of it, treat patients and submit their reports. The epidemiology will go to the field and track cases and submit their own report that this is the number of cases we've seen. Environmental health, we go and test water and say, okay, our water, they are not well chlorinated. The chlorine levels are very low. Our water sources, they are bad, doing their own work on their own. Health educator, the same thing. Although they are working on the same thing, but there is no real, they are not talking to each other. Everybody's just going to submit their report separately. So they are not really, really collaborating. They are collaborating, but it's just a very amateur form of collaboration. You get it now, Abby? Hello, are you still there? Okay, I guess it has muted. So let me know in the chat box if you got it. I need to still, okay, so I've asked everybody to unmute because we still have another. Juwaira, did you get it?
Yes, I did. Thank you.
All right, perfect, perfect. So like, okay, so let's go to the next one. Let's go to the next example. Juwaira, are you there? I don't know why this thing automatically mutes everybody after I'll say unmute. Are you still there?
Yes, I am.
Yes, please. How do I pronounce your name? I don't think I'm pronouncing it correctly.
Yeah, Joeria.
Oh, Juweria.
Yes.
Okay, okay. So you're going to answer number two, the scenario two. Okay.
Okay.
All right, let's go. So there's still this cholera outbreak, and then we have epidemiologists and environmental officers. They go together to go and map the contaminated water source. So the environmental officer and the epidemiologist, both of them, they are working together to, map out the contaminated water sources in that community. And after mapping it out, the next thing, they send their findings, they disseminate it, and then the clinician is able to adjust their treatment protocol based on exposure patterns. Okay? And then the health educator is now able to develop their messages based on the findings of the epidemiologist and the environmental officers. And then this team, they are meeting regularly, maybe weekly, to plan and, implement the plans together. So, Jewelleria, oh God, please pronounce it
Yeah,
again.
you can say Joeria. It's no problem.
Okay, so what
Yeah.
kind of collaboration is happening here?
Interdisciplinary, since they are now making sharing their decisions, you know, they're all meeting together to share the decisions.
Okay, perfect. Thank you. If anyone disagrees in the chat box, you can let us know, okay? The responses here are interdisciplinary collaboration. Okay? All right, so let's look at another scenario. Let me be. Okay, so we have a hospitalized patient that have diabetes. The doctor prescribes medication, the nurse is monitoring vital signs and glucose levels, a dietitian is developing meal plan for the patient, a pharmacist is counseling the patient on medications. They are all coordinating care for this patient. So what kind of collaboration is happening here? Someone should just respond. We are unmuted. So what kind of collaboration is happening? Hey, Chimo.
Okay, good evening. For scenario three, that's multidisciplinary collaboration because you have the different
Multidisciplinary for collaboration.
Someone was talking earlier. Who was the first person that started talking? Please, can you continue? The second person, you're going to also talk. I'm looking at the names now so I can know who is talking. Yes, please. We are not muted, though. We can unmute, please. Let's talk.
Okay, I don't. Can I talk? It's
Yes, my dear.
multidisciplinary
Interprofessional.
collaboration.
Mavis,
Interprofessional.
who is talking?
Mavis.
Okay, Mavis. Okay. Hope you're going to talk soon. Mavis, all right. So go ahead.
It is multidisciplinary collaboration because
Okay.
professionals they are working separately and focusing on their own areas of expertise.
Okay. Okay. So somebody else was trying to speak. Hope, you can go ahead now. Hope, you are
Yeah,
unmuted.
I will
Yes.
pick yes, I will pick professional because we have different profession coming together for a a purpose. They are all going to solve a problem, but they are from different profession coming together.
So you are going with interprofessional, Abby? There's no
Yes.
trans-professional. Okay, so interprofessional. Okay, so we have two what is it called now? Two answers. So is there anybody with a different answer? Okay, so Juliet in the chat said multidisciplinary because the professional coordinates around the same issue without merging their approaches into a unified plan. Okay, now let's look at this again. Let me go back to how do I go back here again? I want to go back to the slide so that we can see it, but well, I'll
Hello.
figure that out in a bit. Yes, I'm listening.
So for me, I chose a interprofessional because from what I understand, different healthcare professionals now they came together to coordinate care to manage that same patient. So whatever they are doing is for the same patient, but different professions are coming together just for one coordinated care for one particular person.
Okay, thank you very much. So, if we look at it very well, we remember that when we talked about interprofessional, I said we're now talking about direct care delivery. Direct care delivery. That's mostly what we're talking about when we're talking about interprofessional. So there are different professionals working to deliver care to this one patients. So direct care services, that's mostly where we start to talk about interprofessional. So now we're now talking about managing a particular patient, direct care delivery to this particular patient. In this case, what we're now looking at is what? Professionals. So the doctor is one professional, the nurse is another professional, the dietitian is another professional, the pharmacist is another professional. So because these different professionals are coming together to coordinate care for this same patient, for this particular patient, this is direct care delivery now. Okay, we are now talking about interprofessional collaboration. When we are talking about direct care services, direct care delivery, that's when we are now talking about interprofessional collaboration. So this is not multidisciplinary because we are talking about direct care delivery. That's the key thing that we should try to remember, because we're talking about direct care delivery now. This is interprofessional that we are looking at. Okay, so let's do another one. So let's look at this now. Please, what we explained just now, is it clear to us? Okay. All right. So the chat box said that it's clear. All right, so now let's look at this this next scenario. Okay, we're still going to answer it. So we have increase in road traffic accidents in a particular state. The Ministry of Health, they've given us the data to say this is the number of accidents that we are having in our states. This is the number of accidents that we are having in the state. Ministry of Transport, they will now look at it and say, okay, so we think we need to implement road safety policies. We need to be tighter on our road safety policies. Then the police unit, they will now enforce helmet use and seatbelt laws, that if you are not using it, you will face some repercussions. Then in schools, they start to teach children about road safety education. And all of these actors, they are working together to reduce road accidents. What do we think is happening here now? What form of collaboration is happening here? Let me be. I've asked everybody to unmute. So just let's talk. What kind of collaboration is happening here now?
This
Okay,
is
Yeah.
a
and everyone. This
cross-sectoral
is a
collaboration.
Cross-sectoral.
multi-sectoral
Good.
approach
Hmm.
because when you talk of
Cross-sectoral.
this,
Yes,
you
yes,
have
yes, yes.
different sectors. The security is
Yes.
involved, the health sector is involved, the transport sector is
Yes.
involved. So they are now trying to get all these sectors to give it a holistic approach. So it's a multi-sectoral approach.
Yes, thank you so much, Jennifer. Thank you. It's multi-sectoral. We all got this one. Nice. Okay. So let's look at this. There's recurring diarrheal disease problem. Diarrhea means passing watery stool more than there's a particular number of times and all of that, right? So there's recurring diarrheal disease problem. And then community leaders, they come to identify unsafe water practices. Okay, then women in that communities, they begin to also suggest the ways that water can be solved. Health workers, researchers, they now come to work with this community to design interventions that is specific to that community. The decisions are made collectively. Look at the people involved: community leaders, the women in the community, healthcare workers, and researchers. The community leaders work to identify unsafe water practices. The women there, they are now suggesting the ways that water can be stored. Healthcare workers and researchers, they are working with this community, with both the leaders and the women, to now design interventions. What kind of collaboration is happening here? Let me be. Let me be.
Good evening, everyone.
Good evening.
I think it's transdisciplinary
Okay, why do you think
because
it's
in this case,
transdisciplinary?
okay, in this case, everyone is coming together to take a decision. They all want to design something that will help them going forward.
Okay, okay, thank
So
you
that's
very
why I think it's
much.
transdisciplinary.
Okay, is there anybody that disagrees with her? Okay, so in the chat box, okay, so we agree with her. So remember that we said when we're talking about transdisciplinary, it's not just that different actors are coming together. There is a new knowledge coming forth. There's a new design, a new conceptual framework that will come out of it. So there's both integration, there's collaboration, and there's co-creation. Okay, so that's what we see in transdisciplinary. I'm sure no way any other thing that is left. All these other ones, we already know these things. So let's move ahead. Make we not waste time, my people. Let me be, let me be. When you move like that on me. So I'm going to go back to the slide. Let me be, let me be. Oh, chin. I thought the slide I wanted to go back to. This Zoom is a little bit confusing for me sometimes. So I'm very happy that we all understand this slideshow one. All right, that we understand these definitions that we have here. Okay, so you can just take a look at them again. Multidisciplinary, there's parallel work. Experts contribute independently from their own disciplines. Okay. Interdisciplinary, there's active integration, shared decision making, and joint responsibilities for outcome. Transdisciplinary, there's new unified framework, and it transcends disciplinary boundaries, and oftentimes there's what co-creation. There's new conceptual frameworks that are being developed. Okay, so we already know the different ways of collaborating, both the interprofessional that is not here and the, what is it called now? There was another one we looked at, cross-sectoral, okay? These ones below, they are now just different modes. So participatory model is just basically like where the community is mostly in research that we see participatory model, where a researcher is actively working with the community. And you're not working with the community as, hey, I just want to share my questionnaire. I just want them to answer the questions. No. In fact, they will develop the things you will need for that your research. They will develop it with you. That's they are working as your co-researchers. Okay, then virtual versus distributed, or virtual versus in person, not distributed, sorry. So this one is just modes of collaboration, where it can happen. For instance, during COVID period, it would not have been possible for teams to be meeting physically every time. Okay, it would not have been possible for teams to be meeting physically every time, so they will be meeting virtually. So that's virtual versus in person, not distributed, please. Then we have something called the hub and spoke method of coordination. In the hub and spoke, let me see. I will need to go back to that previous screen. So in the hub and spoke, what is happening there is what? There is one central body that is coordinating the collaboration, and then they are the ones that are like the leaders, and then they are coordinating with all other sectors. I guess we can see my screen. Can we see my screen? Yeah. He said, let's do it. It's because of time, and we've already left that. Okay, so okay. So look at okay, so what I will do is maybe I will send the questions to the group. I will just copy them and send to the group. So hub and spoke is just a mode of collaboration. It's not necessarily, just have it at the back of your mind. The hub, for instance, it can be one sector or one discipline that will be the hub. For instance, when we're talking about that cross-sectoral example we gave, the healthcare sector can be the hub. They will be the ones coordinating, and then they will be the ones, in charge of the meetings, passing information across to all the other sectors, like the A, B, C, D, all those ones. They will now be other sectors. So the hub will be the people that are mostly in charge, and then they will be the ones to coordinate between all these other sectors. If it is interdisciplinary or transdisciplinary, you will have one hub. So for interdisciplinary, let's say we are working on cholera, the hub, the people coordinating can be maybe it can be the epidemiologist, it can be the environmental health people. They will be the hub. They will, because we need people to be in charge to bring everybody together. Like the meeting that I told us that we had last 2 weeks, I told us that although many sectors were involved, if you listened, I said it was the NGO that was facilitating. So the NGO was the hub. That particular NGO, they were the hub. And then they were the ones that brought together all the other people, UNICEF, Ministry of Health, Ministry of Education. So Ministry of Health can be this the A part of it. B, we can call B maybe Ministry of Education. C can be which ministry? Maybe Ministry of maybe Defense or something. You get, but the people who were coordinating this thing was the NGO. So hub and spoke is just one way that coordination happens. Okay. All right. So let's go back to our screen. Let me be. Okay, so let's now move. Now we've come to team science. So we finished talking about the different ways that collaboration can happen. We cannot just, because collaboration is a big deal. It's a big deal because if you think of it, even between relationship, let's say relationship between two people. For instance, if you're on Twitter, almost every Eke market day, you will see one story of two people that were in a relationship, and one thing happened. Only two people, oh, but wahala, steady wahala, steady wahala. For you to see that once two people are already involved, there is a potential for kasala to burst. There's potential for wahala. Of course, they can do great things, but there's going to be wahala. Okay? It's not just wahala that we're talking about, but the message I'm trying to pass across is that even though these people are coming together, with one goal to achieve something, there can be problems between the way they relate. So what team science is saying is, let's not just be relating based on vibes. Let's actually study how collaboration happens, so that we can better harness it, so that we can do it in such a way that it follows, is strategic, so that we can get the most out of it, so that we can know how to handle collaboration, because it's a big deal. So you see that because of collaboration in public, in health, is what resulted into team science. And team science is saying we need to study how collaboration happens. It's an approach to collaboration where he's saying, let's actually study how this thing happens so that we're not just leaving it to vibes, to chance, to goodwill. So that we can do it well, we can collaborate well. That's why team science is now a discipline, or is now is now something that is being studied. Okay? So in team science, there are a couple of things, a couple of concepts. It's not like this one chapter in our textbook can cover what team science is all about. So we're just going to, learn just a couple of definitions, just a couple of things under team science, because it's a very broad thing to talk about. Okay? So we'll just learn a few concepts here and there under team science and move ahead. So in team science, there is something called shared mental models. What is happening in shared mental models? Shared mental models is saying that if we do not properly develop our goals, if we do not properly, articulate our goals, the roles that each discipline or each professional is expected to play, and the processes in which they are to go about these things, there's going to be problems. Some persons may not even understand clearly what the team is working towards. You see that sometimes you will finish saying something and you think maybe the people you are talking to, that they already understand what's the goal, what we are trying to work towards. And by the time you look deep, you see that they didn't even understand you very well. They don't even understand what their job role is very well. So in shared mental model, what we're saying in shared mental model is, how can we be able to develop models that can help everybody clearly understand the goals that we are working towards, and their roles in achieving these goals, and the processes to doing it. So that's shared mental models. The program that we had last week, where we were talking about where we're working about talking about rapid response team, one of the things we did was we would do these what's it called, like cardboard papers, where we'll now ask everybody, tell me what you think your role is as an environmental health officer. What is your role towards this particular type of epidemic? So for instance, if there's cholera, you as an as an environmental health officer, what do you think is your role? And then you hear people saying the roles, and some of them will get it correctly, and some of them will be saying things that you'll be like, this is not actually your role. Or some of them you'll be like, they are not even saying everything, like some of the main things they're supposed to say. So when you now hear what they have to say, you can now, based on it, the facilitator will now say, okay, you've tried, but this is also part of your role. This is also part of the things you are supposed to do. So by doing it like that for all those people that were around, the disciplines that came around, it was clear to everybody that if there's a pandemic, this is my own work in it. So shared mental models. I won't go into so much detail because there's also something called mind map, and there's a difference between mental models and mind map, but they didn't really talk about that much in our book, and let's just face what they talked about. So the next thing, the next concept we need to have in our head is something called collaborative readiness. Collaborative readiness is an important thing in team science, because we are shouting collaboration, collaboration, we need to collaborate, we need to collaborate. It may not be everybody that is even ready to collaborate, or everybody may think that I'm ready to collaborate, but actually we need to put some things in place for it to be functional, for that our collaborative readiness to be real. So first of all, there have to be motivation to collaborate. So the people you are bringing in, the other sectors, the other disciplines, do they actually want to collaborate, or do they actually prefer to be doing their work by themselves? Say, you should leave us out of this your shenanigans. So collaborative readiness is something that needs to be in fact, before you even start the actual collaboration, we need to ensure that these things are in place before we now even come together. We need to know that there's motivation to collaborate. Also, the skills for effective teamwork. As we go, if you check the book, there are different skills for effective teamwork. One of them is communication, because you may see that different disciplines have different ways of, they have their own jargons. There are things that somebody in economics is saying, and they'll be talking about KPI, this one, that one, and it's different from how the way that I'm going to say that, and if I want to say it in my own discipline. So different disciplines have their own jargons, and you need a skill like communication skill. How can we communicate so that when we say something, everybody can understand it, regardless of the fact that they are in different disciplines? So there are skills that are important for teamwork. Conflict resolution is another skill that is important for teamwork. We need to know how to resolve conflict. Okay, so that's one thing. Then organizational support is important for teamwork. Resources to sustain the relationship over time. So collaborative readiness is another concept that we need to understand. And under collaborative readiness, we are thinking about, is there motivation to collaborate? Do we have the skills to collaborate? Do we have the organizational support for this collaboration? Do we have the resources to sustain the collaboration, the relationship over time? Okay? Now, another terminology that we need to understand is something called boundary spanning. Boundary spanning is basically talking about how we can connect and coordinate across different disciplines, across different groups, different organizations. Like what I just explained, people who are referred to as like things, when we say boundary spanners, they are like people who understand different language that is spoken in different disciplines in such a way that they will be able to translate the concept, so that although we have we have health professionals here, we have people from defense here, we have people from environment here, we have people from these other sectors, you can be able to communicate in a way that all of them will understand the things that we are saying. So that you will not be speaking your own professional jargon and the other person is saying, like, like, what's happening? What are they saying here? So that's boundary spanning, and it's a skill that can be learned. Okay, so that's for those are like just a couple of things that couple of concepts that we should just understand. Then there's something called stages of team development. Stages of team development. So when you are forming a team, remember that we are saying in team science, we are studying these things so that we can know better how to collaborate. Although we are not going into it very deeply in this our study session, because it's very large. So there are different stages of team development. It's just imagine it as a relationship. Actually, there's the forming stage, there's the storming phase, there's the norming, there's performing and transforming. Forming, storming, norming, performing, transforming. Okay, so we're going to go into it one after the other, because this is like an important concept that we need to know. In the forming is where you're just coming together. We're just knowing that we are together in this our team. Well, okay, so you're the person from this department. Nice to meet you. We're coming together. We're coming to collaborate on how to solve this particular problem. That is the forming. We're still getting to know ourselves. We're getting acquainted. Okay, that's forming. We are forming the team. Then there's storming. Storming is now the part where, like every normal relationship, it first of all starts sweetly and to be like sugar and whatever. And then at a point, you be like, it be like this person head not really correct, and you want to fight the person. That's the storming phase. So all those initial conflicts phase, where you'll be like, who is even this person safe? Who are you safe? What is even wrong with you? You start to you know, by the time you start working with some, you can never really know a person from just hello, hi. You really can't know a person until you now actually get to work with the person. You now see that you always they come late to meeting. You say, wahala will start. We gave you work to do. Since you have not done the work, you are always coming to tell us that you know, you start to actually get to know the people you are working with. Conflicts start to arise. Sometimes the conflict may be from, no, it's not the way that you want it to be done, that it will be done. That your way is not, conflict will arise. So the next phase is what? Storming, where everybody wants to attack each other. And then after that storming, you know, it's like after your fight, you now realize that it's like this person a better person. It's like this person actually has sense. It's like this person actually knows what they are doing. You now start to what? You people will now start to flow. In this phase, you are developing shared approaches, expectations. You are now working together. That's the norming phase. Then there's performing phase. You people are now in the fly mode. You're now achieving productive collaboration. Okay? So you're now doing very well as a team. And then there's now transforming phase, where it's also called the adjourning phase, where it's now time for us to conclude our work and everybody will say bye-bye, and let's hold our Kinong Basic get together, be Passover party or whatever it's called, and let's disintegrate. Okay, so I want to just quickly share something. Let me go back to that. So that's just something pictorial to help us remember it well. So we can see here stages of team development. There's the forming phase. So the forming phase, you can see them shaking hands. So we're getting to know each other. That's, you are becoming acquaintances. You're getting to know yourselves. You establish ground rules. Ground rules are like, okay, if you come late to meetings, what's the penalty? What's this one for this? If a person is talking, if their side talks, what's the penalty? What should we allow in this our team? What should we not allow? That's what establishing ground rules. In this phase, everybody is still being very formal. You're observing formality. You still day your day somehow. Okay? And your team members, you're not yet seeing them as a team. You're still seeing them as, yeah, hello, that kind of a thing. So in the forming phase, you get acquainted, ground rules are established, formalities are preserved, and team members are still being treated as strangers. That's the forming phase. Then you can see the storming phase. You can see one person carrying a hammer, and the other person is carrying saw or something. I don't know what that person is carrying. So members start to communicate their feelings. So we've passed the phase where we are still doing, hey, hello, you're the person from this one. Now we are now be able to communicate our feelings. But we are not yet seeing ourselves as a team in this storming phase. And sometimes we can even resist control by group leaders and be showing hostility. That's storming. You can see the name, storming. Is wahala period. And you can extrapolate this to, you can better understand it with what happened in normal human relationships, because that's actually what's playing out here. From hello, hi, you now actually start to fight with the person and you are like, oh, please get out and all of that stuff. And they want to resist control by group leaders. They are showing hostility. And people are still seeing themselves as individuals. They are not yet understanding that it's a team, that we are in a team. Then you now progress to the other phase. You can see the next phase where one person is on top and is trying to pull up the other person. So in this phase, you're now seeing that they are now beginning to understand that we are actually in a team and we need to come together to make this team work. So as public health professionals, why do we need to know this? So that when you are trying to bring people together and you see them fighting, you will not be like, it's like this thing will never work. Oh. You will just say in your mind, okay, we are in the storming phase. What can I do to make us get past this phase easily and quickly? You will not be thrown off guard because you already understand that It is in phases. It's not like everybody will just come in once and will start to become sweetie. No. Okay? So how can I facilitate this thing so that we can move from the storming phase to the numbing phase? Okay, so that's what numbing phase. People start to realize that we can actually do great things if we see things from another person's point of view. We now have the performing phase. People are now relaxed. They are now more trusting. They know that, you have my back, that we are working together, that we are together in this thing. They are no longer looking at who is the organ, who is not the organ. No, we are just moving together to promote health. We are being more flexible. If this person is not around, we can take up that person's role. We can cover up for that person. And we are not saying, this person voted, we are never ever around, always coming late. No, we are looking for how to, cover up for lapses. We are looking for how to help each other so that everybody's moving together. That's the performing phase. This norming performing is the sweet phase. And then we now have what? If you can see the end, you now see the team, they are now carrying their prize. So this is the place where everything is now coming to an end. So the team, they conduct assessments at the end of their period, implement plan for transitioning roles, recognize team members' contribution. So this is now the phase where the work is now coming to an end and we're about to say, we've done well. Thank you, everybody, for the effort we have put in. You see, we have been able to curb this cholera outbreak. Our people are no longer dying from cholera. Thank you to the epidemiologists. Thank you to the environmental health officials. Thank you to the logistician. Thank you to this person. This is now the adjourning phase. And we're now preparing to say, okay, we are going to transition roles. We are going to, go back to our routine ways of working. But how do we do it so that next time, if there's a thing, what are the recommendations we can make so that next time we can easily, we can work easily and all of that. So that's the adjourning phase. Okay. So are we still together? Are we still together? Please let me know in the comments. Okay. All right. Thank you very much. Okay. So let me go back to our slide. I just wanted us to see that maybe the pictures will help us to, understand it better. So now we know like the stages of team development. We know the stages of team development, and we don't need to cram it. Forming, storming, norming, performing, and transforming. Okay? So, what's this one? Integration mechanisms. Regular, well, all these ones, they are just talk. Let's move ahead with our lives. All right, so effective communication in interdisciplinary team. It says communication is the single most critical factor in the success or failure of interdisciplinary collaboration. And we have already talked about communication, how it is very important. We need to understand ourselves. We need to understand what we are doing, understand our roles and all of that. And it says that it's not about how frequent we communicate. When we're talking about team science, the major thing is the fundamental, but in fundamental disciplinary differences in how problems are framed, in the way problems are framed. Because different disciplines, they will see one problem, but because we are coming from different disciplines, we are going to see it from different perspectives. We see it from different perspectives. Me, for instance, the health person can be seeing a problem from the number of lives that are lost, the impact on quality of life. That's what the health person may be seeing. The economic, somebody from the economic aspect of it may be seeing it based on if a person gets this particular disease or this life is lost, a family loses their parents, like what we see in that Jaboya practice, that no sex for fish, that's intervention they had in Lake Victoria. what we see there. A lot of parents, it's an actual story, it's documented. There's even like a documentary on it. You see, people were losing their families, their parents, children were losing their parents. And from the economic point of view, the person will be seeing it as what? Now there's going to be increase in poverty. So it is one problem that we are looking at, but we're going to be looking at it from different perspectives. So the problems will be framed differently. So we need to know how to bring all of these points of views together. Okay? So another thing we need to understand is disciplinary jargon. That every field, we've said it before, every field, they have their own terminology. They have their own specialized terminology. Like you and as an epidemiologist, you'll be saying your odds ratio. You'll be saying your incidence and prevalence. You think the security people will understand when you're saying incidence and prevalence. They won't. But they have their own terminologies as well. So here it says social workers, they can be saying clients empowerment, and you will not understand it. The economic person will be saying market failures, you will not understand it. So these are like disciplinary jargons, different ways that they understand the problem. And we need to have boundary spanners, people who can take these particular terminologies and communicate it in a way that everybody across discipline will understand. Okay, then there are distinct professional cultures. There are different ways that different disciplines like to there are things they prioritize. If you come to me as a researcher now and we are talking, me, I want to see evidence, I want to see data. I need to see what is science saying, what is research saying. Let's get the highest possible evidence. Let's do maybe a randomized control trial for this thing. That's what a medical researcher may be looking at. And then an anthropologist should be saying, we need ethnographic insight into this thing. We need people to go and, live with these people and study how this community behave and all of that. That will be their own, that may be the way their own culture, the way they get their own knowledge. A social worker may be emphasizing relationships. So they are just different professional cultures. And we need to be aware of these things so that we don't start to fight over methodology, timelines, and success metrics. So that we know how to work together. So that if me as a medical researcher, I will not be saying, for instance, we have a problem that is killing people quick. And then we'll be talking about how to conduct one research that is going to take like 2 years. Does it make sense? So that we know how to, when to pull back a bit, how to work with the other people and bring everything together so that we can achieve whatever goals we have. We've talked about translational skills, how to express complex terms so that everybody can understand, and then communication structures. We've talked about boundary spanners, and then there are people called communication brokers as well. Okay? So now we'll now talk about types of leadership. Types of leadership. We'll just go through this thing quickly. I even thought we would be able to do part B of it. Now, I think I talked too much, actually. Maybe if I'm quicker, I'll be able to do more. So let's see collaborative leadership. What's happening here? The different types of collaborative leadership. It says leadership in interdisciplinary settings. It requires fundamentally. Ewo, my battery is low. Give me a minute. Okay, so leadership in interdisciplinary settings, it requires different approach from, the traditional hierarchical model where one person is saying what will happen and the other ones are saying, yes, sir, yes, sir, yeah, we are going to go to this one, yes, sir, we are going to do this one, yes, sir, or yes, ma, yes, sir, yes, ma. No, that's not the kind of leadership. We're not doing hierarchical model of leadership. Hierarchical model is the model where, there's one person that is saying how, how things will go. That's not the kind of leadership that we are doing here. We are doing collaborative leadership. Okay, so there are different types of this leadership. There's distributed leadership, facilitative leadership, adaptive leadership, boundary spanning leadership, and what's this last one? Inclusive leadership. Okay, so distributed leadership, what's happening here is for the different aspects or components of the work, you get different people to lead those aspects. So for instance, when we talk about the cholera outbreak, when we get to the data part of it, the epidemiologist will be the leader. When we get to the part where we want to go into community to check their water sources and check how clean the water sources are, the environmental health will be the person to champion that one. When it's time for us to talk to community, to talk to the community on how to talk to them, give them health education, the health education and promotions officer will be in charge of that one. So that's distributed leadership. That when it gets to a particular component of the work, the people who have that expertise, even though we are working in a team, is them that will now be in charge of that particular aspect. So I will not say because I'm an epidemiologist, even when we are going to the community to check water source, I will be the one to head that part. I will still be the one at the forefront. No. Or we want to go and give health talk to the community, me, I will still be the one to go and do that one. Except there's no health educator around. The people who have that expertise, they should be the one to champion it. So although we are working in a team, but whenever it comes to any particular aspect of the work where we know that this is this person's aspect of it, that person will champion it. So that's distributed leadership. There's no one alpha and omega in this one. No, it's distributed. Okay? Now, facilitative leadership. All these models of leadership is not like we're saying it has to be only this one. No. At different points in time, you can adopt different types of leadership at different points. Facilitative leadership, what's happening here is what? You are basically just, facilitating, as the word implies. You are creating enabling condition for people to contribute. Like the NGO that I mentioned, that it was an NGO that was facilitating. What they will be doing is what they will be asking for. They will say, okay, now let's pass the microphone over to this next person. So tell us, what do you think about this? Tell us your opinion about this. How can you are creating enabling condition for what? For collaboration to happen. You are not saying what is going to happen. You are not saying this is the outcome or this is how this meeting has to go. You're just creating an enabling condition for different people to say their minds, for different disciplines to make their input. So the key thing here is that you are removing barriers. If you notice that, okay, the community, for instance, that they don't understand English, as in facilitative leadership, what do? You're going to get somebody to be translating in their local language, so that there can be collaboration, effective collaboration, because you will not just come there and speak English and assume that everybody understands you. And you have community members who the only thing they understand is Yoruba. Facilitative leadership, you bring a translator so that what will happen? They will translate, so that those community members will understand and they make their input. So anything that will be a barrier, whether it's language barrier, whether it's resource barrier, anything that will be a barrier in facilitative leadership, what you are doing is to remove those barriers so that they can be productive interaction. Okay? You're able to resolve conflicts. For instance, if you are seeing that these people are saying, no, it's not like that, it has to be our own. No, it's not, it has to be our own way. What will happen in facilitative leadership, you are able to resolve that conflict to say, okay, this is how we're going to do it. So let's work in this way. Is this okay with everybody? That's facilitative leadership. Adaptive leadership is basically saying problems they use to take different forms, different morphology, different ways. Adaptive leadership is saying you will not keep your head that this is the way they used to do it since 10 years ago. That's the way we must keep solving this particular problem. No, problems change. For instance, we're in a digital era. There are problems that comes with this digital era. Adaptive leadership means you have to take take all those things into cognizance. Like you have to be aware of those things and see how you people can adapt and evolve with those challenges. So you don't have a solution. For instance, when you are now having infodemics are, when people will be spreading different kinds of rumors, things that are not true. That's an example of an infodemic. Now, as an adaptive leader, let me say, people before you, they've not witnessed this kind of things, infodemics. Now, you have to come up, you and your team, you have to lead them in such a way that you people will be able to navigate this new challenge. It's an uncertainty, it's a new challenge. So you people will be able to experiment with solutions. Let's try this. Maybe this will work. Okay, let's modify, let's adjust. Because we've not encountered this kind of problem before. It's like the COVID-19 pandemic. There have been pandemics, there have been epidemics in the past. But to have a pandemic at that scale, in the past, people were not really traveling very well. But now, it's one of the things we're even going to study if we have the time. One of the things globalization has caused is that if somebody has a disease in India, before you know it can get to Nigeria. Why? Because the world is now a global village. We travel very quickly. Infodemics travel that way as well. A rumor can start somewhere that this vaccine is what used to make children have this one, and it will travel to another place. Now, these are new challenges, these are uncertainties, things that you've not experienced before. As a leader, are you going to run away? No. You now learn how to evolve with the challenge. That's adaptive leadership. We've talked about boundary spanning in leadership. It's a skill that can be acquired. How you can be able to, coordinate between different sectors, different disciplines, and make sure that everybody is being carried along. Inclusive leadership. Inclusive leadership, you are making sure that there is equity. There is not like, if this particular group of discipline, they make contribution, they look down on them and say, these people, they're not really sabi like that. Is this other people that you want to listen to their own? No. Inclusive leadership, let everybody's voice be heard. Okay? So let's move ahead. Hello, why is my slide not moving on? Okay, so far so good. Are we following, please? Are we following? We're going to end this in a bit. Okay. Thank you. All right, so let me see. I don't think this is the last slide. All right. So we're going to be really quick. We spent a lot of time. So what are the benefits of collaboration? In fact, I think we can even say it ourselves. We can see it ourselves. If you have any new ones, you can put it in the chat box. Benefits of collaboration. Why is it good to collaborate? We already see some of the benefits on the screen. Okay, if you have anyone, you can put it in the chat box. Enhanced problem solving. When everybody comes to attack one problem, you get that problem is likely going to bow. So enhanced problem solving, we come up with different frameworks to solve a particular problem. Innovation and creativity. Everybody will come up with their different innovative ways. You'll be more creative in how to solve problems. Resource optimization. Instead of wasting resources, because if we're not collaborating, the thing the other person is doing, you yourself may be doing it, not knowing that that person is still doing it. And then people are wasting time. You are duplicating effort. But resource optimization, if we're working together and have clear roles, we optimize resources better. Comprehensive impact assessment. We are able to, evaluate as a team our intervention. Professional development. You get to learn about what is happening in the other professions. Okay? So, I don't know why my laptop is hanging. Okay, so the other thing that is on the slide is the challenges to collaboration. So what are the challenges to collaboration? I'm sorry, guys. I don't know, my screen is not. Please give me a minute. Okay, so let's see, this one should work. Ah, okay. So we've talked about the benefits of collaboration. Now let's talk about the barriers, because there are barriers to collaboration. And what are these barriers? The barriers can be institutional or structural. What is happening in institutional or structural collaboration? What's the institutional or structural barrier? You see that because organizations are structured around disciplinary or departmental lines, it's difficult to, come up with budgets, to to come up with evaluation criteria and sorry, to come up with evaluation criteria and I'm sorry, my friend is calling me. Okay, so you have, for instance, the Ministry of Health, you have Ministry of Education, you have Ministry of Works. Let's say we want to solve a particular problem now. Things are already organized in very streamlined manner. So if we now want to collaborate, for instance, where is the money going to come out from? The problem we want to solve, who should bring the money, for instance? Where should it be coming from? So you already see the kind of barriers or the kind of challenges you may face. That because they are separate lines, like things are organized in disciplinary lines. Organizations are structured around disciplines where you have, okay, these ones, they are healthcare people. These ones are these transport people. This is this one. If there is now a problem, who should bring the budget? Like, where is the budget going to come from? So all those are like the barriers that we need to be aware of. Okay. And then there's also, how do we come up with evaluation criteria? How do we come up to evaluate to say, okay, we did well or not? Because different disciplines have their own metrics for judging that something went well or something did not go well. Like I mentioned, in healthcare, you can be talking about number of lives, like mortality, morbidity. In economics, they'll be talking about what's all those things they used to say again now. Just, monetary terms. So you now have to start seeing that you now see that there's a challenge in coming up with what evaluation criteria. Also, reward systems. You may notice that in some disciplines, what the disciplines reward is actually how many papers you're able to publish. So me that I'm coming to work with you, I'll be thinking in my head that, oh, is there any paper that's going to come out of this thing now? This problem we are saying we want to team up to solve. Are we going to publish anything in the journal? Because I know that that's one way that it can help me. That's how my own efforts can be rewarded in my own discipline. And another person in their discipline will be thinking about how will their efforts be rewarded, since we are now coming up to say all of us want to solve this particular problem. But our disciplines, there are different things that they count as that you have done well. There are different ways that the metrics that they use to judge that. So they can be challenged with collaboration in that sense. Another thing here, if we see at the top, we have disciplinary chauvinism. Is where people will think that other disciplines are not really important. So yeah, wetin they even sabi, wetin na even they do. Wetin na even dey do for that na social science or those people say all these medical people wetin na even sabi, you people don't even really know that, you get. So that's chauvinism, where you are thinking that it is your own that is the best, your own discipline. You are the ones that have the most knowledge, the most important knowledge. That's very bad. Okay. Another challenge can be communication and coordination. Even look at it, if you are trying to bring different people together, look at time zone may be different. People will come from different authority levels, different maybe one person is a this one, the other person is a this one. You're bringing all of them together. The person who is not really having any high position may think, can I still talk like this? Coordination is challenging. Resource and funding, there are challenges as well. Okay, with power status and differentials, we can understand it. For instance, in interprofessional collaboration, the physicians may, if the physician is not a right thinking physician, they may just dominate over all the other people or think their own efforts, they are not necessary. But that's a physician that is not thinking properly, because normally you would know that everybody is what? Important. Let me tell us, there's something that we need to think about. Even sweepers, for instance, in the hospital setting, even people who sweep, let me tell you how important they are. Yes, scale of preference, thank you. Power tussle, lack of trust, yes, thank you. So even people who sweep, you may think, is it not just sweeping? Not be just to sweep. But let me tell you, if the hospital or our communities are not being swept, everywhere is dirty, sure you see that there's problem. So everybody is important. So anytime you have to collaborate, there should be that self-worth that my work, no matter how you think it's small or how big it is important. And everybody's role is what's important. You can't discard anybody. Epistemological conflict, where some people will say, no, what we need is quantitative research. And the other person will say, no, it's qualitative that we need in this one. And there are people who will prefer to talk about things in an applied manner, and there are those who will be looking at it from a theoretical manner. So the way people conceptualize things, their knowledge, the way they create knowledge, they are different. The things people value in one field, they are not the things other people value in their own field. So we need to be aware of it. And these are one of the things that can cause what? Barriers in collaboration. Let's fly. So case studies of successful collaboration. There have been cases of successful collaboration in the past. In 1948, there was this Birmingham Heart Study. This study was a cohort study where they recruited a number of persons, and what they were doing was taking details from them to find out the risk factors for developing heart diseases. So it was a very large cohort study, which is still ongoing, because even after those first people they took data from, after they died, they said, what the researchers said, let's continue this study because we are learning a lot from it. It's improving healthcare a lot. So let's continue this study. So they even continue to study the children of those initial people, their grandchildren, like that. They've been studying them even up until now. They are still studying. So this study was even how we got to know a lot about the risk factors for heart diseases. That if you're not working out, you're having sedentary lifestyle, all of those risk factors, you're having hyperlipidemia, your lipid level, all those risk factors, it was from this study that we got to know about many of them. And this study influenced a lot of policy. This study, for it to happen successfully, a lot of disciplines had to come into play. Cardiologists were there, epidemiologists were there, statisticians are involved, geneticists are involved, social scientists, they were involved. Even up until now, they are still collaborating on this particular study. So this is an example of a successful collaboration. Then another one was when WHO had to come up with the Commission on Social Determinants of Health. is a framework where, you know, it helps us to create evidence, to synthesize evidence on how people's social conditions create inequities in health, how policies can create inequities in health. That if you're having discriminatory policies, for instance, and you're having poor people live in places, you don't give them good housing, how that can result in health inequities, where you now start, because of the places they live, they will now be the ones coming down with some types of diseases. And this requires collaboration between public health, medicine, sociology, economics, political science, policy studies. Okay? And then now we are having collaboration on One Health. That's the last one here, One Health. So both healthcare, human healthcare, animal healthcare, and environmental scientists, ecological people, everybody is now coming together to now say, how can we address problems that are facing all of us? Infectious diseases. They are the ones championing this antimicrobial resistance. The fact that is one of the key problems that they are trying to solve, antimicrobial resistance. The fact that most of the antibiotics we use, you know, after a while there's resistance, it's no longer effective. So how can we reduce the use of these antibiotics in animals? Because it's now spills over into humans too. It's also raising our resistance level. How can we make food safe and all of those other stuff? So these are 3 examples of successful collaborations. Framingham study, WHO CSDH, that's Commission on Social Determinants of Health, and then One Health framework. So at the moment, there are integrated service delivery models. We're going to end this very soon. I think this should be the second to the last slide or so. There are integrated service delivery frameworks that we have at the moment. And what's happening there is we're saying, instead of just treating this one particular thing, let's still come together to handle these particular problems. For instance, now you hear about things like mother and child, maternal and child health. They are now teaming up. Since it's the mother that will still carry the pregnancy and give birth to the child, and oftentimes it is the mother that is going to, you know, care for that child in the early period of that child's life. Like oftentimes it's maternal. So they are now saying, instead of just leaving obstetrics on one side, child health on another side, we are now having things like what? Maternal and child health coming together to say, since he's still the same person from pregnancy to birth to early child development, let's come together, let's team up. So that's how we now came about maternal and child health. So it's integrating obstetric care, pediatric care, nutrition, parenting support, early child development, family planning, everything. They now try to make it to be holistic, to come together. Okay? Now we also have primary health care, where we are saying, instead of the clinicians to be on one side, communities on another side, how can we team up so that the clinicians, they are also able to, you know, work with people in the community. They are covering particular geographical locations to care for those communities, like what we are doing for Makoko East, where for instance we are saying we are the ones in charge of this Makoko community now, and we are not just going to be in the clinic. No, let's go into the community and see how they live and see how we can integrate preventive services and how we can help the population. We also have what? Mental health and substance abuse. So, you know, mental health is basically where we are talking about how to care for our, how to ensure that people are mentally okay, that they are able to cope with the challenges of life. That's mental health. Now, substance abuse is a part where we are talking about there are people who now lean into substance use, using substances that cause addiction, like marijuana, some people alcohol. So they are now saying, instead of separating mental health from substance abuse, let's come together such that we see that these problems that they occur together. A person who is having mental health issue is the same person who is likely going to lean into substance use. So instead of us to be addressing these problems separately, let's team up and form an integrated mental health and substance abuse care for people. Okay, so key success factors across all integrated models, there are factors that will predict success. If there's shared information system such that there's data integration, if there's co-location such that if a patient is coming to the hospital, for instance, it won't the obstetric, if you go to many hospitals, actually, let me even think of it. If you go to hospitals, they try to see how they can make the obstetrics part of it to be close to the child health side section. There's co-location. How do we bring these things together? How do we bring them together? Not just in talking, but in terms of even physical structures so that they are near each other. Okay? How can we have shared performance metrics so that instead of one person is talking about morbidity, mortality, the other person is talking about this scale of preference I saw there, or KPIs. How can we come together to team up to say this should now be our metric for judging whether we are doing well or not? Okay, so that's that. Okay, so now we have this applied question. So let's just think through it together. Okay, we're going to just look at these questions together quickly. It's not like we're going to say everything, no, but let's just think of this question. So the Kwara State Ministry of Health, are we still here? Please respond in the chat. Let me know that we are still here. Make I know they ask question, and please, if we're still here, please just respond. Okay. We're going to end soon. I'm sorry that we are staying this long. Okay, so let's look at this. The Kwara State Ministry of Health, they want to establish a task force to reduce maternal mortality. Maternal mortality means women dying from pregnancy-related causes. So they want to see how they can reduce maternal mortality in the rural local government areas. By rural, we mean like villages. Now, this team will include obstetrician, epidemiologists, community health extension workers, social workers, local government officials. So it says distinguish between multidisciplinary, interdisciplinary, and transdisciplinary models of collaboration, and recommend with justification which model is most appropriate for this task force. In your answer, address collaborative readiness, likely barriers, and leadership approach that may be required. So can we answer this together? Do we think we can answer these questions together? Should we do it together? Or we should move on to the next topic? What do we think? Should we answer the questions together? Okay, so someone said we should answer it together. Please give me a minute. All right, so I'm back. Sorry, I had to take a call. My friend has been trying to reach me. Okay, so we said let's do it together. All right, I love this. Okay, so we'll go one after the other, one after the other. Let's go, my people. So the first thing here said, I think we already know how to distinguish between multidisciplinary, interdisciplinary, and transdisciplinary models of collaboration. I think we already know how to do that. So let's go to the next aspect of this question. Let's go to the next aspect because we've already done this one before. Now, let us recommend which model we think is more appropriate for this task force and justify it. So which model of collaboration do we think is more appropriate for this task force, and why do you think it is the most appropriate? So I'm going to unmute. I'm going to ask us to unmute. So let's unmute and talk to the class. So the question we're answering now is, which model do we think is the best model, and why do you think it is the best model for us to use in solving this problem? Okay. Someone said multidisciplinary in the chat. Yes, I need us to unmute because we need to say why we think it is the best model to use. I've asked all of us to unmute. Please, you can unmute your microphone. This example. Are we still here?
Yes. Yeah.
Okay, so let's go. What do you think is the best method of collaboration? Yes. Please now let's talk. Let's talk, please. Let's say it's, what do you think is the best and why do you think it is the best? Please now, my people, make we talk. Okay, so someone said transdisciplinary because it includes professional, non-professional to collaborate together in solving real-world problem. Okay. Someone said multidisciplinary. Please, if we can unmute and just and make our points, it would be very nice. Please, I need us to let's collaborate. Let's collaborate, I beg, my people. I'm assuming the point we're making is that we probably didn't is it that we did not understand this topic? Okay, someone said we can. I've asked everybody to unmute. We are not muted though. You can unmute, please. Yeah?
Hello.
Yes. Hi. Good evening.
Good evening. I think it will be transdisciplinary.
Okay.
My reason is that they will need to come together. All those people involved, the obstetrician.
Sorry, can you speak louder?
Okay, sorry, I'm actually on transit. That's why, but I'll try and be audible.
Okay. Sorry.
I was saying that I think transdisciplinary model would be better because they will have to come up with new knowledge on ways for them to handle that particular challenge.
Okay, thank you very much, Idara.
Yeah.
Thank you. Okay, so Idara said transdisciplinary because they may need to come up with new ways of, solving that challenge. Okay. Does anyone disagree? Does anybody have does anybody have a method they think is different from what she said?
I would like to go for interdisciplinary.
Okay.
Because apart from the ex-professional that were involved, the local government official were also involved, the social worker, as in, because of that, the local government official, I want to say that maybe interdisciplinary will be the most appropriate. But since there's not going to be maybe any new something to come up with, that's why I won't go for the disciplinary.
Okay.
It's not specified here that they should come up with a new modality or something like that, Sha.
Okay. So we have two responses. Hope says she would go for interdisciplinary, because first of all, there are multiple disciplines coming together to collaborate, and also that it's not specified that they should come up with anything new. And then Idara said she would go with transdisciplinary because they may need to come up with a new way to solve that problem. So what's there's no way to do a poll. Let me see. There should be, but that will take our time actually. Oh yes, I can set up the poll. Let me see. Well, this Zoom used to take time to load, so let's just move ahead. So I think this depends on how you can justify your own response. I think it depends on how you can justify your own response. For me, I would go with and my response is not the correct answer per se, because you have to, it depends on how well you are able to justify your own recommendation. So it's not like, okay, the answer I want to say that I want to say the correct answer. No, I want to give my own point of view. Okay. So for me, I would go with what? I would go with a transdisciplinary model. Why I'm going with a transdisciplinary model is because when all of these disciplines, the obstetrician, the epidemiologists, the community health extension workers, social workers, and local government officials, when they are going to team up to work, now, I don't think that they are going to come up with anything that will not involve the community, even though it is not stated here. Whatever interventions that they are going to design, this is a rural local government, and they are going to have specific problems that would be responsible for this maternal mortality. It could be the fact that men are the ones in charge of the healthcare making decision in that their local government. It could be different reasons. It could be that they think that maybe the health care system there, that maybe the nurses they are rude or something. Reasons like that can make them say, no, we prefer to be going to the traditional birth assistants, those women that used to massage belly and help with delivery. We prefer to go there than to go to the hospital. So we need to work with them to find out what is the reason that you people that what is the reason for this maternal mortality. We need to work with them. We cannot, the obstetrician, epidemiologist, community health worker, and all the rest, they may not be able to get all of these answers, except we work with the villagers, with the rural people, to first of all understand this problem, and then work with them to now design a solution, and that solution will be specific to them. Because remember that we cannot say because this is what this community did to solve, to reduce maternal mortality, that if we bring it to this other local government, that is going to work in that local government. We need to contextualize our solutions. And because of that, it may actually result in developing something that is new, something that is contextual. It may not be that that solution has never existed before. It's just something that is more specific to them. Also, the interdisciplinary too, it can work. It can be, it's just a thing of how well you are able to justify your recommendation. Okay, so we've been able to answer we've been able to answer the first and the second questions, which is to distinguish and then recommend. Now, the next thing we are going to answer is, how are we going to ensure collaborative readiness? We've explained what collaborative readiness is. So how do you think we can ensure collaborative readiness in this setting? Let me go back to the slide where we talked about collaborative readiness. This thing we are doing is basically we are trying to answer questions in a way that is not just define this, define that. Collaborative readiness. Where you did? Okay, so this was the slide where we talked about collaborative readiness. Okay, it has motivation to collaborate, skills for teamwork, organizational support, resources to sustain relationship over time. So we've seen it. So in this particular setting, how can we ensure collaborative readiness? What can we do to ensure collaborative readiness? There are no right or wrong answers. Let's just, let's keep talking. I've asked us to unmute.
Sorry, which question? Sorry, I was locked out. Is it question or question two?
We're still on question one. We're talking about how do we ensure collaborative readiness in this setting?
We must motivate them for the collaboration.
Good. We must motivate them for collaboration. So how do we think we can bring about this motivation between how can we motivate the obstetrician, epidemiologists, community health extension workers, and all of that? So let's say you are the one in charge of this thing now. How can you motivate these people to see the need for the collaboration? What can we do? My people, let's all be talking, no. Let's all be talking. We are learning how to answer applied questions by what we are doing. He said by having shared goals for better health outcomes, effective communication is paramount. Good. Transdisciplinary, okay, I think I've read that before. Allows, okay, someone says interdisciplinary is the most appropriate. Okay. Okay, which may be unrealistic in, okay. So, like I said, it's basically everybody, let's all be saying what we think, so long as you can justify it. This is not where we're choosing A or B. So this is us trying to apply our knowledge. Okay, so let's keep it going, let's keep it moving. How do we think we can actually motivate all of these people? What do we think we can do to motivate these people? Imagine that this question is before us on the day we're writing the proctored exam. How do you think you
I
can
keep
motivate
going and
these people
coming.
to come together to collaborate?
Hey, good evening. I think
Good
one,
evening.
shared vision and goal, where every member agree upon this is the goal, this is the vision. This prevents, keeps the teams aligned, and then define rules and responsibilities. So each discipline, like here we have the obstetrician, community health worker, local officials. So they have their specific contribution mapped out, but they also have to recognize other people's contribution and the need for joint work. And then I think communication can be also be improved via regular meeting, joint reporting system, and to ensure that there's a smooth flow of communication across discipline and the levels of authority. And I think another thing should be cross training section that will allow each professional to understand what the other professional is doing and from their understand their own perspective. Example, the obstetrician can learn about community health realities and gain more insight. And then every other person should be included, all disciplines should be included in decision making.
Thank you very much. Thank you so, so much. That was very, very wonderful and insightful. Thank you so much. So we've all heard the contributions that she made. Okay. So let's move to the next question. Uh what are the likely barriers and which leadership approach is required? So let's quickly answer this question. That's where we're going to end. We're not answering question 2. We've tried today. So what are the likely barriers? We talked about barriers to, let's think of this as a way of revising what we have learned. You really do not know something until you have articulated it. So let's not be quiet. Just say whatever it is that you understand. So from this kind of collaboration, what are the likely barriers that we think can come up? What are the things that are likely to be challenges when this team decide to come together? And also, what kind of leadership approach do you think will work in this setting? So let's answer. We are not muted, though. We can unmute and talk. And if nobody talk, it will be assignment. All of us will carry and go do for our house. So let's share knowledge. What kind of leadership approach do you think is necessary here? What kind of leadership approach do you think is necessary? What are the challenges you think that this team will face? It's okay. So we're going to take that as our take-home assignment alongside question 2. All right, my people. Is there any contribution, any question? I think we've tried for today. Okay, someone said participatory leadership. Thank you. Thank you very much. So these are the ones that were listed in our textbook. Distributed leadership, facilitative leadership, adaptive leadership, boundary spanning leadership, inclusive leadership. So I think what you wanted to say was probably inclusive leadership. No, you're saying I should explain this thing to us before we go. No, Rara, we have to talk. At least I've been talking since, so I expect us to make attempts towards answering the questions. And if we no go answer, it will be assignments for all of us. All right. So we're going to end this session here. I don't know if towards the evening, towards the night, I would have time to run through the other one. I don't know. If I do, I'm going to just put it up on the group so that anybody that is available can join in. But I'll see how we can finish this very one, this study session, because it's just part A that we have learned. But I believe the session was helpful. All right, my people. Take care, take care. Bye, everybody. If there's no question or contribution, take care. Okay, Juliet's answer just came in. Thank you. Resource constraint, overlapping rules, professional chauvinism. Yes, thank you. Thank you very much. Ola, your hand is raised. You want to ask a question? You can go ahead. I guess that was a mistake. All right. Good night, everybody.